My recommit motion is an opportunity for everyone in this chamber to put the angry rhetoric surrounding health care reform aside and stand up for seniors and future Medicare recipients and every American who has been diagnosed with cancer and other pre-existing conditions. This recommit motion holds special meaning for me because I am a cancer survivor. I was diagnosed with prostate cancer that was most likely caused by my service in the Vietnam War and exposure to Agent Orange. Fortunately, as a career soldier, I had access to affordable, quality public health insurance to help me beat that nasty disease. Many other Americans are not so lucky. With this in mind, this final amendment is more important than ever. Medicare accepts all seniors. Private insurance companies do not. This must change, and requiring these companies to prove that they do not charge more or deny coverage to seniors and the 129 million people under 65 who have a pre-existing condition is an important first step. I would submit that probably every one of us in this chamber have received calls from some of our constituents who have been paying for insurance for years and years. They got a malady, they got cancer, they're in the hospital, they're getting treatment, insurance comes due and they can't renew it because they got a pre-existing condition. That's got to stop. Health insurance changes will be a one-stop shop for tens of millions of Americans to purchase individual policies. This market must be open only to the companies that provide affordable insurance to all Americans, young, old, sick and well, male and female. My recommit motion, this final amendment, would require that our role as a government is to protect the well-being of our citizens, not the bottom line of insurance companies, which are doing just fine, by the way. America's health insurance companies increased their profits by 56% in 2009, while 2.7 million people lost their private coverage. The nation's 5 largest for-profit insurers reported a combined profit of $12.2 billion the same year, according to a report by Healthcare for America Now. I support American companies making profits. However, these numbers indicate there is no reason why private insurance companies should deny coverage to seniors or Americans struggling with cancer and other pre-existing conditions. My amendment would ensure that if they want to expand their insurance pool to include Americans purchasing through health care exchanges and grow their customer base even more, then they must cover everyone fairly, seniors, future Medicare recipients, and cancer patients included. Let's be clear. The passage of this amendment will not prevent the passage of the underlying bill. If the amendment is adopted, it will be incorporated into the bill, and the bill will be immediately voted upon. Even though we may disagree on the bill today, we have the opportunity to stand together for those afflicted with cancer and other pre-existing conditions and our nation's future Medicare recipients who would lose guaranteed health care benefits under the Ryan Plan. It's up to us. I urge everyone to vote yes on this final amendment. I yield back.
Gentleman yields back.